And so being able to say, well, this is great because if they're saying they even want to start a family, go ahead and get them tested, because if it comes back and there's any issues, now you can, with confidence, get them to the fertility clinic before they wasted that year, because that's what they were doing. They were following the guidelines of the infertility diagnosis, saying, well, I can't send you to a fertility clinic until you've been trying for over a year.
That's what really fascinates us, is that there is a biomarker that has been under researched and undervalued that could correlate or give a better idea on, let's say, prostate health and prostate cancer, or it can go beyond and just overall men's health. And so I think there's a huge potential there.
That also, I had another question earlier, which was regarding the freezing of sperm. What's the idea behind that? Like, who's a candidate for that? Is it something that we do when we're younger and healthier for later, if we anticipate that we're going to have problems? Because then maybe that's where it's important to, again, figure out early if we get any indications that we may have a problem.
So the majority of the people that are taking advantage of fertility preservation is people who have been diagnosed with cancer, people who are going to undergo any kind of hormone treatment that'll affect sperm production, people with certain diseases that could lead to a treatment that could cause sterility. And we've even had a lot of soldiers before they ship out wanting to go ahead and freeze sperm. So there's a lot of different reasons to utilize something like that. If you know you need testosterone therapy and you know it's going to cause an issue with your sperm production, you may want to go ahead and freeze some sperm. So there's really a lot of reasons to do it. Maybe you don't want to have children until you're much, much older. Age is a little bit less of a factor that is thought of for men, but it is a factor. Age does decline men's fertility, maybe not as dramatically as women's, but it is something to think about.
The one thing I'll add to it as well is that it's just a great way to now just have a backup plan and be, especially on the sperm freezing side, if something happens, at least you have that and you're able to have kids or have a good shot too. So I think especially now, we're finding that more and more people are considering it and going with it. It's great to have these kind of different options.
Absolutely. Earlier, there's the part that fascinated me really was, and just from a biological standpoint, was how the male who suffer from infertility also carry more disease burdens. Essentially, they're predisposed to more diseases. Or can you kind of shed light on that, April, or Thiv yourself? I thought that was fascinating.
Yeah, I think there's more and more research coming out about the correlation between male infertility and other conditions. And that's what really fascinates us, is that there is a biomarker that has been under researched and undervalued that could correlate or give a better idea on, let's say, prostate health and prostate cancer, or it can go beyond and just overall men's health. And so I think there's a huge potential there. And why aren't we using it for that full potential? And I think that's what's really exciting. So I think probably in the next couple of years, we're going to see more and more of that come out and show that, hey, you can actually use sperm health maybe to be better at finding prostate cancer or other cancers. And that's exciting, because I think more to us on prevention. Wouldn't it be great to do a sperm test every year, part of your physical, and understand what are your risks, what's going on, and not just look at it as purely for fertility, and change it so that it's really about sperm health and overall health.
Are there any such ideas that are coming about with clinicians when you present to them your solution with home testing kit? Is that some of the things that they're thinking
I would
about?
say prostate health is probably the one that comes up more often than not, and probably the more research. I don't know, April, have you heard of others from clinicians?
Yeah, I mean, I've heard from a few about heart disease is another thing. So and diabetes is is really, it's also,
Yeah.
really on the forefront of everyone's minds right now. So I would say those are the main ones.
Okay. And just to kind of like wrap things up, are there any aspects of fertility care that you're looking forward to in terms of whether it's just more in the field of innovation, more in the field of technology, more in the field of awareness and prevention? If you can kind of like share your perspective on that.
For me, and I think for us here at Hera, the big thing that we are really excited about is how can we change or reimagine how testing and treatment happens with male infertility. So I'm really excited on how can we evolve the testing so that we can uncover more about sperm health. Because I think the more information we get, the more accurate, the more precise, all of that, we can really tackle these issues that people are facing. And that's what really I'm excited about right now. And then from there, potentially bring up and find out and uncover other conditions that potentially could be happening. I'm really get a good idea of what's going on with this person and their health. So I think that the testing one for sure for me is really exciting. April.
I mean, I think for me, it's really exciting to bring the guy into the fertility journey a lot sooner. I think that the infertility journey has been really difficult for women, feeling alone, trying to figure out, what's going on with me and taking on that burden by themselves. And then him coming in so much later. I think what I heard most was from the point of view of the male partner, he wanted to help, but didn't know how and didn't know what his role in this was. And so I'm really excited about bringing him in earlier so that they can walk through this together because, unfortunately, couples that go through fertility journeys like this, have a really high rate of separating. And so I really think that being able to get them both on the same page and supporting each other through the whole thing is really going to help change that narrative because, we're building families. We're not trying to break them up. So yeah, I think it's really important for the couple to get through this and build a strong family on the other side.
Yeah. What more can be done to address the traumatic aspect of that when you're talking about relationships breaking up as a result of this? People never trying again. Even I'm sure sometimes people may have that finally conceive and they're like, we're done. We're not, this was too much effort. This was too much, like we don't want to go through this again. What can be done or what is being done to address that traumatic aspect of what people go through?
Yeah, I think the important thing through this is communication. And I think that's what I heard in all of the different interviews and people that I talked to is, she doesn't know how to talk to him about what she needs from him. And he doesn't know how to talk to her because no one is wanting to make the other one feel bad. And I think really having that communication and understanding we're going through this together. It's not on me. It's not on you. I've got my stuff to do. You've got yours. We're going to figure this out and we're going to do this together and talk about it every step of the way. I really think that's going to help. And I think the communication has been so divided because she's going through her part first and then he gets pulled in. And I think that it'll be easier to communicate about all of it if they are doing it together from the beginning.
That is so amazing. Like, and I think we've touched base on this just a tiny bit couple minutes ago, but what are clinicians' thoughts when you first present them? Like, hey, people can start testing at home early. What has been the journey like to try and integrate this into clinics and what ideas are coming about with this here? Because I feel like there's so many opportunities within this field, especially even just having more conversations about it. Now we're opening up this whole can of worm in terms of prevention and what you can do at home or what you can do early on. Like, what are there like little light bulb moments that are going up with some of the clinicians that you present this technology to?
I think I remember one moment recently with a women's clinic where they're seeing countless patients come in and there was that light bulb moment where they saw the true potential here where they can finally get the guy tested and get the information that they need so they can provide the good care that and the treatment that they want to do. So I think that because now they can easily just hand it to that person and be like, give it to your partner. So I think that clinicians really see that this could be a game changer and really help them. And that's really important for us. We don't want to replace any relationship that a patient is having with the clinician or how they are working with the health system. We want to be a part of it. We want to be the piece. So that's why it's super important for us to get that buy-in from the clinician, their trust and their respect on the quality of our program. And so, yeah, when I see that, I know that there is that moment, and that's important because then they'll order and they'll use it and they'll find it valuable.
Yeah, I think there was a family doc that I was having a conversation with, and it was just in this moment of, if they want to have a baby, I just send them to the fertility clinic. Like, I don't know when I should. I don't know what I should be getting in advance. And so being able to say, well, this is great because if they're saying they even want to start a family, go ahead and get them tested, because if it comes back and there's any issues, now you can, with confidence, get them to the fertility clinic before they wasted that year, because that's what they were doing. They were following the guidelines of the infertility diagnosis, saying, well, I can't send you to a fertility clinic until you've been trying for over a year. If he has a low sperm count or an issue with quality, like, you can send them much sooner. And so then they're able to get the help they need a lot sooner. They're not as frustrated. It's just a much better experience for the patient, and the clinics are being brought in at a better time than the current, process of getting frustrated patients that have already gone through so much.
Mm-hmm. Is there, and I'm sure there's logistics behind this that can mitigate costs, but especially once you guys are producing at greater scales, what about like the cost of it? Like, was it a costly thing for this testing process to be also done in the hospital? Are we relieving a certain cost element by doing it at home as well? And there has to be, because if we're taking up more time in the hospitals, more visitations, hospitals and clinics are already crowded. We know that. Mm-hmm. How does your solution also tackle the cost element of things?
Yeah, no, it's an important piece because cost plays a big role in overall access and getting people to use it. Right now, we're at cost to what they would spend at a hospital or a lot of these different places. But our goal is to bring that cost down more and more and to get it covered. That way it becomes fully accessible and it becomes a no-brainer for everyone. And it's not just for people who can afford it. So that's a big goal and big focus for us. And, as a startup, it's going to require a lot of brain power and resources to think through, figure out how do we do that without disrupting quality. But on top of that, we're also bringing new innovations that may uncover things and hopefully prevent additional costs. What if our way allows more and more people to get pregnant without IVF and therefore not spend the 10, 20, maybe $40,000 that they would with IVF? So our goal is to really make it super, super accessible in multiple ways.
Amazing. No, thank you so much. We've covered a lot of ground with this conversation here. I'm so happy we had the opportunity to do this. Is there anything that we've missed or any closing remarks on your part? Even let us know what's ahead and what's ahead for Hera Fertility and where people can find out more about your work and your product.
Yeah, and I thank you for allowing us to do this. This has been awesome, a lot of fun. I think, number one, you can check us out on herafertility.co. You can get our products there and services. But also, feel free to reach out to either one of us anytime if you have questions. A lot of times we're answering these kind of questions and supporting people because this is a journey. This isn't something that just happens the next day. You got to be prepared, and we're here to help. And we're able to answer questions that you may have, both men and women-wise.